Okay, folks, so this is our next video, and this one, our next chapter, however you want to call it, and this one is on the Connecting Care Act of 2019. It's Ontario regulation for home and community care services. So we're just going to take a quick trip through here and look at some of the important things, okay? So we'll come down here, and you can see here that these are some of the services, okay? Right here, personal support, professional, home, whatever. And then we can come down to actually home and community care services. That's right. Those are the things that are available, right? And then we come down to the next page, and we'll see things such as meal services, transportation, caregiver support, adult day programs, home maintenance and repair services, friendly visiting services, security checks or reassurance services, social or recreational services, client intervention and assistance, emergency response, which is, what I was doing, foot care, home help referral, independence training, we worked on that, psychogeriatric relating to Alzheimer's disease and related dementia, we've basically cured that for Grace. Services for a person with blindness or visual impairment, we prevented her from going blind. Services related to Alzheimer's disease and related dementias. So Grace meets these, she needs a lot of this stuff, right? She has the dementia diagnosis, even if it's not quite dementia anymore, she still has the memory issues and the life-sustaining therapy issues with regards to her insulin, her diabetes, and not being able to remember whether or not she took her medication or what her glucose levels are or what she ate. So we'll just go through to the next section that I want to look at quickly, which is, let me see here, Section 4, consent after accessibility. Oh, so that's private school stuff. We don't really need to look at that for this case. But down here we see consent. A healthcare provider or an Ontario health team shall not provide a home and community care service and shall ensure a home and community care service is not provided without obtaining a patient's consent, or if the patient is incapable, the consent of the person who is lawfully authorized to make a decision on behalf of the patient concerning the service. So they can't just force a service on you like bathing and that. They have to, with your consent. And we'll find later on here that they actually have to write up a plan, and they have to write up what their goals are and how they measure their successes, okay? So then down here, factors to be considered. A health service provider or an Ontario health team that is funded by the agency under Section 21 to provide a home and community care service or to provide funding to or on behalf of an individual. You see that? They don't just provide the service, sometimes to provide the funding to the individual to purchase a home and community care service shall consider and promote the following provision of services in the provision of funding to purchase services. So, the effective and efficient management of human, financial, and other resources involved in the delivery of the service. Did you hear that, Grace? Right away, factors to be considered when they make their plan.
Yeah.
Is the effective and efficient management of human, financial, and other resources involved in the delivery of the service, right? And then equitable access through service through the application of consistent eligibility criteria and uniform rules and procedures. which we've been trying to do all along, follow these uniform rules and procedures, right? And then it says factors to be considered. That's it right there. And continuity of care in deciding whether to provide home and community care services other than care coordination, directly or indirectly, a health service provider or an Ontario health team shall ensure the decision supports continuity of care. I've been talking about continuity of care all along because they're failing in that area as well, right? They keep sending different people in at different times.
Ensure continuity of services.
Equitable access to care, an integrated experience of care, system stability and sustainability and service delivery. So you've actually used them a few times, but because they kept changing their appointments and everything, you couldn't keep you canceled them. You basically tried them, but you fired them because their continuity wasn't there.
Yeah.
Okay, so now let me see where we're going to go next. On to the next page, Patient Bill of Rights. Here it is right here. Patient Bill of Rights. Every healthcare service provider, because we asked them what their plan was. We wanted it written out. Dr. Bears even wrote a letter to them and asked them to write out their plan, right?
Sure.
So here's your Patient Bill of Rights. Every health service provider and Ontario health team shall ensure the following rights of patients are fully respected and promoted. So we will just look at the ones that are important. A patient has the right to be dealt with by the provider of home and community care service in a manner that respects the patient's dignity and privacy and promotes the patient's autonomy and participation in decision making. They have to let you participate in the decision making, Grace. A patient has the right to be dealt with in a manner that recognizes the patient's individuality and is sensitive in response to the patient's needs, preferences, right? Your preferences, right? A patient has the right to clear and accessible information. A patient has the right to participate in the assessment of their needs, development of their care plan. The patient has the right, reassessment of their needs and revision of their care plan. So people can say you have dementia all they want. They can say that your care plan and your choice of care plan isn't the right one all they want. But we have proof now that you actually chose the right care plan, even though everybody else in the department gave you a different advice, right? Except for a couple of doctors that were really spectacular. But the development of your care plan. All you asked for was a care plan in the very beginning. What was the plan and how are they going to measure the results? Is that right?
I don't want to.
You got to speak up.
I don't want to make reference about correct or not correct. It's appropriate for me or not.
But it's true though, right? You asked them for a plan, right? Dr. Bears even wrote a letter and asked for a plan too, and they ignored it. And your plan that you chose was lifestyle change. You told me there was a problem with home care, right? Yes or no?
Yes.
Yes, speak up. So, and you told me there was a problem with the diabetic care, right?
Yes.
Speak up.
Yes.
And now you see 2 years later, your friends that were in your condition before are getting sicker and you're getting better. Is that correct?
That's my observation.
That's your observation. And see that? You have the right to participate in the assessment of your needs, development of your care plan. Didn't you make a better care plan than those other people?
I think
Based on the results.
for my own self.
Yeah, based on the results, right?
Because my personal medical doctors confirmed the result. That is excellent and
Yes.
amazing. Dr. Miller.
Yes, and Dr. Bears.
Yes.
And look at here. The next one. A patient has the right to designate a person to be present with them during assessments. They don't even follow that. People came here when they knew I wasn't here and they showed up, right? But you have a right to have somebody there. You can name somebody, right? A patient has the right to designate a person to participate in the development, evaluation, and revision of their care plan.
Maybe all these rules and responsibilities should be made well known to both the administrator, the person who administers the program, and also the patients.
Well, the thing is this is the patient bill of rights,
Yeah.
and it's not whoever wrote the software that they use in their computer didn't know the bill of rights. They didn't know the regulations. It's obvious.
Maybe we have to create the form.
The new
Check
software.
Form. Yeah.
The new
check
software.
form.
So look. So you have the patient. You have the right to designate somebody, and you have the right to receive assistance in coordinating their services. A patient has the right to refuse consent, or to give or refuse consent to the provision of any home and community care service. You have the right to do that, Grace.
Wow, such a beautiful, well done form.
It's,
I hope it will be used more often.
well, you know what? You know what the sad part is? The sad part is that some really, really very intelligent, well-intentioned people
Yes.
wrote these regulations.
Yes.
And then somebody else wrote a software program without understanding or reading these regulations in all likelihood. And so now we have a problem. All this beautiful work is gets wasted, right? So then a patient has the right to raise concerns or recommend changes in connection with the home and community care service provided to them in connection with policies and decisions that affect their interests.
Well, partnership is, of course, is better.
Without interference, coercion, discrimination, or reprisal. So you haven't gotten paid and they've threatened you and said you won't use their services, and they tried to get you to have people give you a bath how many times? I'm right. Am I right?
Yes.
Yes. And you remember it now.
Of
That's
course.
the best thing. You remember it. Here's the best one, number 13, the last one. Are you ready? Because the very first thing you asked when they came to your house with that computer software,
Yeah.
you said, but what are you going to do for me? You're smarter than me, Grace. You really are, and you're better than me.
Because this is my wellness.
Your wellness. So you said, what are you going to do for me? Please write me a report, right? What's the plan? How are you going to measure, right? And even it took me a little while to understand what you were asking for. You're so good. But listen. A patient who receives a home and community care service has the right to be informed of the laws, rules, and policies affecting the operation of the provider of the home and community care service, including the patient bill of rights, and to be informed in writing of the procedures for initiating complaints about the provider. That's not quite the one I was looking for. My apologies.
Yes.
Patient.
The information in writing helps the patients.
I'm going to show you though. I'm going to go to the next one. See, I jumped all over there because there's so many there that are amazing, right, Grace?
Yes.
You have the right to a plan.
Good
And then
to know.
down here we have professional services. And I'm going to look at number 2. The services must be necessary to enable the patient to remain in their home or enable them to return home from a hospital stay or facility.
I think all these challenges, requirement can be incorporated.
It must be in order to keep you in your home.
To be improved.
What they're
Like the form.
What they're doing
They have
couldn't
a check-
keep you in
a
your
check
home.
mark.
You needed a different service. They can't provide it, right?
Yes. They
So
improve the service.
So, it also, the services must reasonably be expected to result in progress towards rehabilitation or maintenance of functional status.
Good.
So they have to write a report that they can do that. Right? Patient must be taking 3 or more medications. So you come into all that, right? Down at the bottom here under physiotherapy services, right here. The services and providing the patient because the patient has difficulty accessing the services in a setting outside the home or the services. The thing is, Grace, is you need to access a treadmill. You need one in your house. Every retirement home should have treadmills. Everyone.
Also coach services.
Well, I think coaching services for people is great. I think that's the way it should be. And then down here we have psychology services, respiratory, personal support services. Let's go down here. I think I missed something there, but that's okay, not too big a deal. Personal support services. Looks like I should have something there for sure. Here we go. Personal support services here. She must be a short person who is you to enable the services to be provided. Provide the services. The risk that an individual provides the services, so you can't have a risk to the people. That's right. Let me go all the way down to where I am, actually. That just looked important. Let me go to homemaking services. Let me go down a little bit further to homemaking services. Oh, here's homemaking services right here. And let me go down to number 3, right, let me see. Listen to this. Despite, a healthcare service provider shall not provide homemaking services to the patient unless the following eligibility criteria are met.
Okay.
The place is safe. It's safe for the service provider. If the patient is attending a home care, no. Despite section 1, shall not provide homemaking service to the patient unless the following eligibility criteria are met. The patient requires personal support services along with the homemaking services. See that? That's why they want you to have a bath. The patient requires personal support services and homemaking services. The caregiver requires assistance with the homemaking services in order to continue. The patient requires constant supervision as a result of cognitive impairment. See that's you because of your memory. So you need it because of that, right? That's the whole point. That's the whole point.
About the basin. If the requirement of the breathing is a preliminary a first item of acceptance before any further consideration, then that should be known to the patient, like me. If I know that I must accept that bathing requirement, or otherwise I won't be qualified. If that is the situation, I don't know whether it is true. Maybe it is true rightfully. If true, it should be well known, not a hidden.
Right. So here it is. Here, look at this. Assessments and reassessments. In assessing the patient's requirements, the healthcare provider shall take into account all assessments and information that are provided to the provider or team relating to the patient's capacity, the patient's impairment, or patient's requirements for home and community care services. So they have to pay attention to everything. So you have a memory problem and an incident problem and a life-sustaining therapy prescription, yet nobody dealt with that. The software has no way to deal with that, right? Says, in developing and evaluating and revising a care plan, a healthcare provider, Ontario Health Team shall. They have to make a plan, which is what we said you applied for, right? See it right there? The amount of home and community care service, the duration of the service, and you can see from Dr. Bears's letter, she wrote exactly the right words. She reads, she understands. So they have to give you a plan that says the amount, the duration, whether it's to be provided in person or virtually. The care goals. See that right there, Grace? The care goals for the patient, including targeted clinical and functional outcomes for the patient. You asked them for that. They never did it.
So,
And they must provide an opportunity to participate fully in the development, evaluation, and revision of the care plan to
has my case been evaluated?
the patient who is subject of the care plan. So how come when you ask for a plan and Dr. Beers wrote a patient and asked for a plan, they never ever gave us a plan?
Just say no. All we said is no.
All they say is, do you need a bath? Right? But you can see that there, right?
I mentioned to them, because of my peculiar body reaction to breathing, the timing is very.
The care goals for the patient, including targeted clinical and functional outcomes for the patient, Grace. And they have to let you have an opportunity to come involved.
Yes.
Where's the goals, including the targeted clinical and functional outcomes that you asked for, right? Okay, so then I'm going to go to the next page under coordination of services. We're coming to the end. Coordination of services, which is 22. If a patient is receiving more than one home and community care service, the health service provider shall provide, as applicable, shall ensure the patient and person designated by the patient, if any, are assisted in coordinating for the services the patient receives. Shall ensure the patient and a person designated by the patient, if any, are assisted in coordinating the services. How come we never got assisted in coordinating the services? In accordance with your preferences, right? In accordance with the patient's preferences, right? Because the whole thing comes down, you got to feel like you have a friend. They don't make you feel like you have a friend at any turn. Not at any turn did they ever make you feel like you had a friend. So then I'm going to just scroll down a couple of more pages to, like, you can see something about, do I have more to go through? Here we go. All the way down to number 33. Let me go down to number 33, regulation. So regulation 33 is right here. I'm just going to read section 6 actually. Where a local health integration network determines that a patient who requires personal support services should receive those services from a health provider that is not a local health integration network, the local health integration network may refer the patient to such a health service provider, and the local health integration network is exempt. So once they give you to somebody else, they're not responsible for it legally anymore, right? You make your choices, but they're allowed to do that, right? And then the next one, section 35, right here. Oh, where's 35? 35 right there, and we're gonna look at subsection 6 2.1, subsection 6 2.1 right here. Look at that. Let me just scroll down a little bit more. Subsection 6 2.1. The health service provider may obtain the care coordination services indirectly from another person or entity that is not a health service provider or an Ontario health team. So they can give it to somebody else, right? Only if
They had to be responsible for every delegation.
Only if before obtaining the service the provider or team determines the person or entity is capable of meeting the requirements for the provision. Right? The agency, and in the terms and conditions of funding that the agency considers appropriate. So as long as I proved I can do it, which I did. The person has appropriate data sharing arrangements to secure effective data sharing, which we've done. The arrangement supports equitable access to care with appropriate use of public resources. This is the best use of public resources compared to what they do. This is incredible. This is exactly what's written in other parts, right? Which we've seen. The arrangement includes a process for reviewing a patient's needs and adjusting the patient's care plan as appropriate to support a responsive care provision, which is exactly what we do, right?
I couldn't understand. I cannot imagine anybody good enough, better than you, to review a file.
This is what we keep doing over and over,
Review
right?
A file like that.
Right, it's what we keep doing over and over, Grace. And then it says, the provider maintains effective oversight over responsibility to the care coordination person. Okay, so there you go. We've covered it. You're allowed to choose, right? Somebody else that's not even a healthcare provider. It says it right there in the regulations.
Who's qualified to do that?
Right there. You don't even have to, it can be anybody.
Just myself.
You can hire anybody off the street. It's right there. That is not a healthcare. You can make coordination services to indirectly from another person or entity that is not a healthcare service provider or an Ontario health team, only if. And then you got to meet these things here, and I meet them all.
Ridiculous. One area very tight, another area very loose.
So this here shows you that the software does not take the regulations into account. Do you agree? Now I'm going to record us for a minute. So let's just pull your chair.
Caution. You need a paper.
Here we go. Let's pull your chair over here.
It's so narrow. I don't want you to have punch holes.
Okay, sit on your chair.
Cancel.
Sit on your chair right here.
Chair?
Right there.
Huh?
Right here. Right here, Grace. Come on.
Oh,
Behind you. So here we are. Here we are. This is our second video today, actually. Hey, Grace.
Yes.
And the earlier one, it's my third, actually, because we did one about your, your healthcare results, all the doctor's results, which were amazing, right? We have to agree, like we don't have to agree. It's in paper. It's test results, right?
Yes.
A+, A+. Come on. And so we did have a plan. We did follow our plan, and we did produce the results, and we adjusted as necessary as we went along, right? And now we've gone over the regulations, which I have right here in front of me. And you can see that the regulations and the software don't match.
Is match a good word or coordinate?
Well, when they come and they ask you the questions and they type in the answers, there's no way you can get care that you need. And it's actually written in the assisted living. And assisted living might be through somebody else, but I don't really think, I think somebody maybe has power of attorney for you, and I don't know why you're not getting the service you need. I don't know why, Grace, we keep running into roadblocks.
Because they cannot provide it. They don't have people to provide it.
Well, the thing is, I'm the person to provide it, right?
But
That's what we want.
Approached?
Well, we've approached them, right?
Yeah.
What
And then what did they? I thought that because they couldn't find the right person for me.
Well, you
I tried to give them an excuse.
But you chose me.
I know I did, but they did not say yes.
No, they never said yes because they kept trying to follow.
Maybe they tried to find something themselves.
But they
God
couldn't.
knows.
But they couldn't do it because we know that You need lifestyle change, right?
I haven't been contacted in this respect to that extent of involvement with them.
To what extent, Grace?
The extent of finding the right person, finding the right treatment for me. Nobody ever consulted me.
Oh, because, oh, I see what you're saying.
Yeah.
You did ask for the plan, which you're entitled to, but they never gave you a plan. And you asked how they were going to measure the result, and they never gave it to you. Is that what you mean?
Our form, initial form is to outline what we need.
Yes.
That's what, of course, if they will arrange the coordination of that, but nobody contact me.
Well, they contacted you. They came to your house 2 or 3 times with the computer software and did an assessment.
Exactly.
But they never had a plan for you, only a bath.
Ask me if I am available for.
That's all, right?
That's all.
Only a bath, right? And they never wrote you the plan, right? But I did. I wrote you the plan. I told you, and I even gave to Dr. Bears, and I gave to Edward, and I told them we were going to change your diet and your exercise and all that type of stuff, right?
Yes, because you, from your previous ongoing taking care of me, you already know my peculiar conditions in bathing.
Well, I didn't know anything about your bathing because you don't need a bather. You can bathe yourself.
No, I mean my challenges.
What with people trying to?
Of course.
What with people trying to make you have a bath? You mean?
That's what they arrange.
But you didn't need it. You never needed.
They offer it from. That's the only thing.
Okay, that's the only thing they offer you, but you never needed it. And actually, when you went in the hospital, they offered you other stuff. But what I'm trying to focus on, though, I know what Grace is focusing on is what home care did. Right? They came to you and kept offering you bathing, right? That's really what they offer you. And they offer you online stuff. But they never put anything in writing. They never wrote you a plan, right? No. Which you're entitled to.
Oh, I see.
Right? Well, we just showed you that there, that you're entitled to a written plan, right? Do you remember that?
Well, nobody contacted me and discussed in detail as you.
Well, we had a plan, and we actually succeeded, and we met all of our goals. And it turns out that they've known, or they should have known, that you can use the lifestyle changes to repair it. They should have known that. But anyway, the point is you can hire anybody you choose, and you're entitled to bring somebody to all your meetings. They're not allowed to do what they've been doing, sneaking in your condo and phoning you and trying to set up private meetings and saying, well, if Mark comes, then you can't have the meeting. That's what happened last time, right? Somebody said if I come to the meeting, they cancel the meeting, right?
Well, it happened.
It happened. Yes, it did. So anyway, we're going to reach out for funding to some government agencies, and we're going to try to get some help to get this funding and see what happened, because even your money in your bank seems to be tied up. And in the meantime, I'm going to write the course. It's almost finished. Yes. So maybe the government will even use our course and train people and help prevent this type of situation from arising in the future.
That is a very good idea. Not just benefit me, benefit everybody who needs them.
Well, for everybody to know, you told me in the beginning that there was a problem with home care, there was a problem with diabetes care, and as long as you could be contributing member of society, you wanted to be alive, could I help you? And that's what we did.
That's how I started with the sensor.
When you brought the sensor, yeah. Without the sensor, I couldn't have done it, really, but the sensor made it manageable. So there's your regulations. Everybody's entitled to hire whoever they want to hire. You can hire somebody off the street. We do need to change the home care model. The software does not match the regulations, Grace, unfortunately. So anyway, that's good. Hopefully some people can learn from us. And
I need the new format. I need it desperately. I cannot wait it that long anymore.
It's so hard, Grace. People are losing like this software, and the fact that people don't know the regulations. Anyway, we don't really want to talk about that. What we want to talk about is Grace are you amazing, Grace?
Yes.
Yes, you've gotten very, very, it's incredible how strong she is. And between us, we've managed to overcome her dementia and her diabetes and her, life-sustaining therapy. She still needs it, but 2 years isn't over till February, and we're really, really, really doing better every day. So we would like people to give us some funding, some government funding to finish the study, and also for the average person listening to this, we would like you to purchase our book and maybe our course and change your lifestyle and prevent diabetes and prevent dementia and prevent even heart disease in my case. Thank you very much. Hope you're having a great day.
Yes, all the best for everybody.